Understanding and Managing Type 2 Diabetes, Science-Based Insights. Introduction. Diabetes is a widespread chronic condition that affects how the body processes blood sugar, glucose, a critical energy source. Many people misunderstand the differences between type 1 and type 2 diabetes, leading to confusion about causes, management, and long-term health risks. Type 1 diabetes is an autoimmune condition in which the immune system attacks insulin-producing cells in the pancreas. It requires lifelong insulin therapy and often begins in childhood or early adulthood. Type 2 diabetes is characterized by insulin resistance, where the body's cells no longer respond effectively to insulin, and a progressive decline in insulin production. It is often linked to lifestyle factors such as diet, exercise, and weight, though genetics and environmental factors also play a role. Unlike type 1 diabetes, type 2 diabetes can often be managed and, in some cases, put into remission through lifestyle modifications. However, without proper care, it can lead to severe complications such as heart disease, nerve damage, kidney failure, and blindness. This article explores the latest scientific insights into type 2 diabetes, including its causes, symptoms, risk factors, and the most effective management strategies. Understanding type 2 diabetes. What happens in the body? In a healthy person, the pancreas produces insulin, a hormone that helps transport glucose from the bloodstream into cells, where it is used for energy. However, in type 2 diabetes, cells become resistant to insulin, meaning glucose cannot enter efficiently. The pancreas overproduces insulin to compensate for this resistance. Over time, insulin production declines, leading to elevated blood sugar levels. Chronic high blood sugar, hyperglycemia, damages organs, blood vessels, and nerves, increasing the risk of serious health complications. Risk factors for type 2 diabetes. 1. Lifestyle and dietary factors. Excess body weight, particularly abdominal fat, increases insulin resistance. A diet high in processed foods, refined carbohydrates, and sugary beverages contributes to metabolic dysfunction. Physical inactivity reduces insulin sensitivity, leading to impaired glucose regulation. 2. Genetic and environmental factors. Having a family history of diabetes significantly raises the risk. People of certain ethnic backgrounds, e.g., Hispanic, African American, Native American, South Asian, have a higher genetic predisposition. Age. While traditionally considered a condition of middle age and older adults, rates of type 2 diabetes are rising in younger individuals due to poor diet and sedentary lifestyles. 3. Metabolic conditions. Metabolic syndrome, a combination of high blood pressure, high triglycerides, low HDL cholesterol, and a large waist circumference, is a strong predictor of type 2 diabetes. Chronic inflammation and hormonal imbalances, such as elevated cortisol from stress, contribute to insulin resistance. Symptoms of type 2 diabetes. Many people with type 2 diabetes remain undiagnosed for years due to mild or vague symptoms. However, early detection is crucial for preventing complications. Common symptoms: frequent urination, polyuria, excessive thirst, polydipsia, unexplained weight loss or gain, increased hunger, fatigue and sluggishness, blurred vision, slow wound healing, frequent infections, skin, gums, urinary tract, numbness or tingling in the hands and feet, neuropathy. Long-term complications. If left uncontrolled, type 2 diabetes can cause severe and irreversible damage to vital organs. Cardiovascular disease. Diabetes doubles the risk of heart attacks and strokes. Neuropathy. Nerve damage can lead to chronic pain, loss of sensation, and increased risk of amputation. Kidney disease. Nephropathy. One of the leading causes of kidney failure requiring dialysis or transplant. Retinopathy and vision loss. High blood sugar damages the small blood vessels in the eyes, increasing the risk of blindness. Cognitive decline. Research links type 2 diabetes to Alzheimer's disease and other forms of dementia. Early intervention can significantly reduce these risks. Science-based strategies for managing type 2 diabetes. 1. Nutrition, eating for blood sugar control. Emphasize whole foods, vegetables, lean proteins, fiber-rich legumes, and healthy fats. Reduce high glycemic foods, limit refined grains, added sugars, and processed snacks. Include anti-inflammatory nutrients. Curcumin from turmeric, quercetin, magnesium, and omega-3 fatty acids may support insulin sensitivity. Monitor carbohydrate intake. Portion control and balanced meals help stabilize blood sugar. Stay hydrated. Water supports kidney function and reduces excessive glucose buildup. 2. Physical activity, a natural insulin booster. Aerobic exercise, walking, cycling, swimming, improves insulin sensitivity. Resistance training, weightlifting, bodyweight exercises increases glucose uptake in muscles. Movement throughout the day, prolonged sitting contributes to insulin resistance. Aim to stand and stretch regularly. 3. Sleep and stress management. Lack of sleep disrupts insulin regulation and increases cravings for high sugar foods. Stress elevates cortisol, which contributes to higher blood sugar levels. Mind-body practices like meditation, heart math techniques, deep breathing, and gratitude exercises improve metabolic function. 4. Supplements and nutrients. Magnesium, essential for glucose metabolism. Alpha lipoic acid, ALA, may support insulin sensitivity. Vitamin D deficiency is linked to increased diabetes risk. Probiotics. Gut bacteria play a role in glucose regulation. 5. Medical monitoring and personalized care. Regular blood sugar testing helps track progress. A 1C test measures average blood sugar over 2 to 3 months. Blood pressure and cholesterol management reduce cardiovascular risks. Medications, if prescribed by a doctor, can help when lifestyle changes alone aren't enough. Debunking myths. Can type 2 diabetes be cured? There is no definitive cure for diabetes, but remission is possible with sustained lifestyle changes. Studies show that weight loss, dietary shifts, and increased activity can restore normal glucose levels in some individuals. However, diabetes is a chronic condition that requires ongoing care and management. Even if blood sugar levels normalize, regular monitoring remains essential. Disclaimer. The information provided in this article is for educational purposes only and should not be used as a substitute for professional medical advice. Always consult a healthcare provider before making any changes to your diet, exercise, or medication regimen.